Now coming to an approach to a patient with diarrhea. Diarrhea is loosely defined as passage of abnormally formed liquid or unformed stools at an increased frequency. So it should be either abnormally liquid or the stool should be unformed. In Western diet, stool weight should be more than 200 grams per day. It is known as diarrhea. So acute diarrhea is if the duration is less than 2 weeks. Persistent diarrhea is if the duration of diarrhea is 2 to 4 weeks. And chronic diarrhea means the duration of diarrhea is more than 4 weeks. So according to the endemic areas, we are supposed to know certain types of organisms that are frequently asked in MCQs. So if the patient has roamed in some wilderness, like patient is a camper or backpacker or swimmers, the common organism is Giardia. If the patient, the question they give that cruise ships is mentioned, then the organism is norovirus. If the patient has inhabited gone to Nepal, the most common organism is Cyclospora. In Russia, it is Giardia again. In Latin America, Africa, and Asia, the commonest organism are enterotoxigenic, toxigenic, enteroaggregative E. coli, Campylobacter, Shigella, Norvovirus, Coronavirus, and Salmonella. Now, based on particular type of food, certain organisms grow in certain kind of food. So, in case of picnic, banquet, or restaurant, the common organism are Salmonella, Campylobacter, Shigella, which are commonly grow in chicken, pound chicken, or enterohemorrhagic E. coli in undercooked hamburger. If the patient has eaten fried rice or reheated food, the most common organism is Bacillus cereus. If in eggs, the organism which is found is Salmonella. In case of frozen foods, fresh uncooked foods and cheese, the organism is Listeria. In raw seafood, it is Vibrio, Salmonella, and acute hepatitis A. So this slide is very important. A lot of questions get asked on this from this chart. Now coming to a very important subtopic in diarrhea, that is diarrhea in HIV/AIDS. So the most common organisms are Mycobacterium species, viral infections like cytomegalovirus, adenovirus, and herpes simplex virus, protozoan organism like Cryptosporidium, Isospora belli, Microsporidia, and Blastomycosis hominis. Per vaginally or per rectally, the organisms common are Neisseria hominis, Treponema pallidum, and Chlamydia. Again, this is a very important chart from Harrison. This is association between pathophysiology of causative agents, clinical features in case of acute diarrhea. Just remember more about the incubation period of this patient. That is more important. Other rest of the things are not that important from this chart. So if the toxins are already produced, if the preformed toxins are there, the incubation period is usually low. So if the patient presents within 1 to 8 hours of ingestion of food, the most common organism is Bacillus cereus and Staphylococcus aureus or Clostridium perfringens. The duration is 6 to 24 hours for incubation period is around 6 to 24 hours, 8 to 24 hours for Clostridium perfringens. Now, if there is an enterotoxin which is produced, the most common organisms are Vibrio cholerae, enterotoxigenic E. coli, Klebsiella pneumoniae, and Aeromonas species. The incubation period is 8 to 72 hours. Now, E. coli, Giardia organisms, Cryptosporidiosis, and other helminthic organisms, the incubation period is 1 to 8 days. Now, cytotoxin producers or cytotoxin are produced by organisms like Clostridium difficile, hemorrhagic E. coli. For Clostridium difficile, the incubation period is 1 to 3 days, and hemorrhagic E. coli duration is 12 to 72 hours. Clostridium difficile is mostly found in a hospital setting where the patient is on prolonged duration of antibiotics. It causes very important thing known as pseudomembranous colitis. The drug of choice for this Clostridium difficile is usually metronidazole. If they do not respond to metronidazole, we give vancomycin. Now, invasive organisms like minimal inflammation, it causes rotavirus and norovirus. The incubation period is 1 to 3 days. Now, variable inflammation is found in Salmonella, Campylobacter, Aeronomus species, Vibrio parahemolyticus, and Yersinia species. The incubation period is very much variable from 12 hours to 11 days. Severe inflammation is caused by Shigella species, enteroinvasive E. coli, and Entamoeba histolytica. The incubation period is ranging from 12 hours to 8 days. So this is another very important chart where a lot of questions get asked on this topic. So the systemic manifestations of diarrhea are Salmonella, Campylobacter, Shigella, and Yersinia causes reactive arthritis, also known as Ritter syndrome. The triad of Ritter syndrome is arthritis, urethritis, and conjunctivitis. Yersinia, it also causes autoimmune type thyroiditis, pericarditis, and glomerulonephritis. Enterohemorrhagic E. coli and Shigella post that infection, which already we know is HUS, hemolytic uremic syndrome, most commonly seen in the pediatric population. Infective diarrhea, after that, the systemic manifestation of infective diarrhea would be post-infectious IBS, celiac disease, and Crohn's disease. The causative organisms for persistent diarrhea are most common of the organism is Giardia lumbia, Clostridium difficile, Enteromoeba histolytica, Cryptosporidium, and Campylobacter. Now, all cases of acute diarrhea need not be evaluated. What are the indications for evaluation in case of acute diarrhea? First is profuse diarrhea with dehydration. If there is blood in stools, if fever is more than 101 degree Fahrenheit, if duration is more than 48 hours without improvement, a patient gives history of recent antibiotic use, new community outbreaks associated with severe abdominal pain in patients more than 50 years of age, elderly more than 70 years, and immunocompromised patients. Based on severity of dehydration, diarrhea, mild dehydration, moderate dehydration, and severe dehydration. See, in case of severe dehydration, there is lethargy, feeble pulse, hypotension, and shock. In moderate dehydration, there is orthostatic fall in BP, skill tenting, and sunken eyes. In mild dehydration, there is thirst, dry mouth, decrease in axilla sweat, decreased urine output, and slight weight loss. In case of now difference between small bowel and large bowel diarrhea, in case of small bowel diarrhea, the diarrhea is large volume and watery diarrhea. In case of large bowel diarrhea, it is frequent, small volume, and there are painful bowel movements. Associated clinical features are abdominal cramping, bloating, and gas formation, whereas in large bowel diarrhea, it is gripping pain and lower abdomen. Fever is uncommon in case of small bowel diarrhea, whereas it is present in case of large bowel diarrhea. Tenesmus is absent in case of small bowel, it is present in case of large bowel diarrhea. Blood or mucus in stools is not common, it is common in case of large bowel diarrhea. Inflammatory cells and red blood cells in stool are absent, whereas present in case of large bowel diarrhea. Osmotic diarrhea, carbohydrate malabsorption, there is low fecal pH. Lactose malabsorption is tested by lactose bread testing or by a therapeutic trial with lactose exclusion and observation of the effect of lactose challenge. That's like you exclude lactose food from the diet and see whether the diarrhea resolves. So when covering up the diarrhea topic, It's very important to know bit of ORS. It is taught better in pediatrics, but on PSM, but I just like to highlight it. So reduced osmolarity ORS or reduced salt ORS. Sodium is 2.6, trisodium citrate is 2.9, potassium chloride is 1.5 gram, glucose is 13.5 gram, or sucrose is 27 gram. Right, this all composition you should know.